my work at the Hackett Center is we really focus regionally on the things that are happening in Houston and the Gulf Coast region. One of the reasons why we were founded was that we recognize that there's often a disconnect between what's happening in Austin at the state level, and then even when good policy is passed, how do we translate that and make sure that the lives of everyday people are impacted by that policy. And so our motto is putting policy into praxis. And so we really focus on the implementation side of policy. And so my work at the Hackett Center in Houston is a couple of things. One, focusing on community resilience. We heard today a lot about the fragmentation of the behavioral health system and lack of access and workforce challenges. And those things are incredibly important. We want to supplement and add to that conversation. Well, what about the communities that seem to be resilient? What about all the folks who are not in mental health crisis? And how do we learn from those communities about resilience, around collective efficacy, and pro-social behavior, communities really having this connectiveness that seems, according to my research and the literature, that really mitigates against having youth going into mental health crisis. So we try to take those learnings and then inform policy makers around how do we build up the things that we know work well, while simultaneously trying to fix the things that we know don't work so well. Prior to me coming as executive director of the Hackett Center, really worked at the state level to get SB 11 passed. And that increases access to psychiatric services through primary care providers. So they call it CPAN, and then the schools TCHAT. So locally in Houston, we have 2 medical centers there who are working to implement, get on the ground, TCHAT and CPAN to expand access for families who have youth in crisis and need access to mental and behavioral health services. I also am coming from the Baker Institute of Public Policy, where I created a children's health program there. And so at the Hackett Center, we're focusing very deeply on early childhood and how do we prevent youth from having mental health crises at a very young age. And so that's through supporting relational health with parents, on building community, and create systems and infrastructures that support families through the life course.